So good afternoon, everyone, and welcome to today's session. And as members keep on kindly introduce yourself in the chat box and write your name, the organization you're representing, even the institution that you're coming from, and most importantly as well, let us know which county you're coming from. And as we wait for a number to at least to pick up, then let's take a minute of time. Then maybe be able to start. Or should you give it a few minutes? It's very wonderful to see a lot of participants joining in today. So as we keep on coming, kindly write your name, your organization that you're representing, whether it's a facility, just the institution that you're coming from, please write it on the chat box, as well the county that you're representing in today's webinar. Thank you. I think we already have a forum. We can start. And maybe we'll just start with a word of prayer. And I'll pray. So, dear God, we thank you for bringing us together today as we discuss important issues around tuberculosis and the human rights aspect. Guide our conversations and help us gain knowledge that will support people affected in our communities and even the societies we come from. Bless our speakers, our participants, and the work that they all do to promote health and dignified and care for all, each and every population. I pray this short prayer, trusting and believing in Jesus' name. So yes, good afternoon, everyone, and a warm welcome to all participants joining us today. My name is Vivian Faith, and I am honored to serve as your moderator for the Pre-World TB Day webinar that is mostly organized by the Ministry of Health Kenya and through the National TB Leprosy and Lung Disease program as we prepare to mark the World TB Day that is supposed to happen on 24th March. So just to go through a brief on TB, tuberculosis, commonly known as TB, has affected communities for many years and remains one of the major public health challenges, both globally and even here in Kenya, But however, over the time, conversation around TB has grown beyond just the medical treatment aspect of it as the disease itself, and it has also become about human dignity, the fairness, and the rights of people affected by TB. And when you look at it at a global perspective, both the global and the Kenyan perspective, there have been efforts that have been made just to ensure that our TB patients are treated with respect. Yeah, they're treated with their respect. There's confidentiality in whatever they do. Then the equal access to treatment, and there's freedom from stigma and discrimination that normally occurs in our societies. And through all this has led to some of the development and important guidance, such as the TB Patients Charter, which outlines very clearly both the rights and responsibilities of our TB patients. So on today's discussion, it will help us get to understand how the rights apply within our society or even our communities that we stay in, the workplaces that entails where we get to go to work, either formal or informal platforms, all that is the workplace, and as well the institutions that entails the aspect of school, right, so long as it's an institution, all places. So maybe just to go through, I'll be sharing I just want to share just like a few things in regards to maybe something we can just reflect on. So I'm trying to look at it in a perspective whereby a young person has been coughing for quite some time, but apparently now this person decides to walk to a facility whereby they feel like they're going to get treatment, they're going to be helped, but rather on when they get there, there's no confidentiality at all, at all. So they end up even being diagnosed with TB, but starting the treatment becomes a problem for them. And now I'm trying to look at, or I'm even trying to imagine a different situation where that same person, that young person, walks into a facility and the reception of the facility is very much well organized, and the same person are able to respect that patient who walks in. The same people have confidentiality protocols, and they are able to even to support this client, and even the society that person is going back to, they're able to encourage this person who is on TB drugs just to adhere to drugs and encourage him or the person to take drugs. So in such an environment, the person feels a little bit, not even a little bit, just too much safe and to continue with the TB treatment. And even that person gets to complete their TB journey. So you can imagine that person ends up completing their treatment journey, and the same person decides to be like a TB champion or even a TB advocate. So the question that I'll let for us to ponder is like, what kind of environment, based on the two scenarios that I've just shared, what kind of environment are we creating in our communities or even our societies for people who are affected by TB? Okay. So through today's session, so, so through today's session, we hope to be able to increase awareness on TB and human rights for our participants, and even strengthen the understanding of the TB Patients Charter at its best. And as well, through these sections, we want to encourage the communities to actively participate in ending TB. And once again, I just want to thank you all for the time joining us today during this webinar. And I look forward to having an engaging, insightful session throughout this moment. So before we proceed, allow me to share a few quick guidelines that will be able to take us through these sessions. One, kindly we are requesting, if you are not selected to speak, we would kindly request for you to mute unless you are invited to speak. And as well, you may share your questions. You might be having questions, you might be having comments. Kindly highlight them in the chat box. We will be able to go through them. And we will have a discussion whereby we'll be having a Q&A later on once the panelists have been able to give their presentations at the end of the two speakers. So thank you once again. And to help us better understand the patient name, the patient's charter, and it's important in protecting our rights of TB patients, we will now hear from our first speaker who will guide us through, sorry about that, let me mute. Sorry. Who will guide us through this topic in more detail. So our first speaker is Mrs. Dorcas Kiptui, who is a renowned public health expert and advocate with over 20 years of experience in policy development and legislative processes within the healthcare sector. Ms. Kiptui currently serves as an Assistant Director of Clinical Services at the Ministry of Health, working within the National TB, Leprosy and Lung Disease Program as the focal person for TB, human rights and gender. She is a clinical officer by training and holds a master's degree in public health, specializing in public policy and healthy program management. She also holds a postgraduate diploma in health promotion and global health diplomacy, among several other professional qualifications. Dorcas here, who is with us today on this webinar, brings a vast experience and leadership in public health space and has been widely recognized for her contributions to healthy policy. She has been acknowledged as one of the most influential women in tobacco control and NCBs, and she received a World Health Organization award for her outstanding work. In addition, she served as a bureau member representing the African region in the development of two global public health treaties, including the WHO Framework Convention of of Tobacco Control and the Protocol to Eliminate Illicit Trade in Tobacco Products. She also played a key role in national domestication of these treaties into Kenya's tobacco control. In fact, Ms. Kiptui is deeply passionate and vigorous in system reforms that ensures every person's health needs are met in an efficient, equitable, and professional manner, while empowering communities to make healthier choices. In her presentation today, Ms. Dorcas will help us understand the TB Patients Charter, its key principles, and why it's even important to ensure that people affected by TB are treated with dignity, respect, and fairness. So it is therefore my great pleasure to invite Mrs. Dorcas Kiptui to take us through her presentation. Ms. Dorcas, the floor is yours.
Thank you very much and good afternoon. And good afternoon. I thank you Vivian, for the introduction, and I thank you participants for making time to attend this webinar in preparation and drumming up towards the World TB Day. I think we have had several webinars in the past weeks, and today we are going to take this opportunity to understand better the patient charter, the roles and responsibilities of each of us. And at the end of this presentation, I hope that I'll be able to talk about TB disease. I think already Vivian has done that for me. And to understand key definitions and basic principles of gender and human rights in the healthcare context. I hope that you will be able to understand the efforts the country has made, the government has made towards meeting the needs of TB patients within the human rights area, and also to understand, I will try to highlight some of the provisions of the patient charter. And I hope that at the end of this meeting, the utilization of TB, patients and the public will be encouraged to utilize the TB services effectively. So I will talk about the global trends and TB and human rights and national actions to address TB, and I'll do an illustration. Basically, the TB disease, majority of us have inhaled a TB mycobacterium, and it is very rampant in the settings of our country, and so many people have TB bacterium. But because we are, maybe you're healthy or you're fit or you're well nourished, and then, or your body you have high immunity, and then your body is able to manage to contain the TB bacteria. But as time progresses and you become old or you develop a disease, your immunity goes down, or you, for some reason, your immunity is not able to contain it anymore, and then it becomes an active TB disease, and you start to have symptoms, and then you seek care in the hospitals, and then that's where you begin the care cascade for TB. So in Kenyan context, Kenya is one of the high burden countries for TB. We used to be also high burden for drug-resistant TB, but now with the interventions from the program, we are out of the top TB, the drug-resistant TB burden countries, but we still have a high burden of TB because in the last year, about 117,000 people fell ill with TB, and only 94,833 were notified or were notified in the hospital, meaning they were diagnosed and put on treatment, and some were not diagnosed. So we are missing out on about 21,000 people. And the treatment coverage is quite high in Kenya. It should be 100%, but it's still low. It's at 81, with 56% of all patients affected by TB being men, followed by women at 31%, and 13% of the people affected by TB are children. As you can see from the two graphs in the middle and on your right, the burden of TB is going down in our country. Also, the death from TB is going down in our country because of the efforts that the government has put in place to address TB. So TB is a global problem. It's a global priority, and therefore countries come together and set targets to achieve by 2030. And we have 5 key targets, and the target is to reduce the incidence of TB by 80% compared to the 2015 baseline for Kenya, to reduce TB deaths by 90% by 2030, to reduce the burden of chronic lung disease by 20%, and to reduce disability, people diagnosed with leprosy, disability grade 2 and below, and lastly, to ensure that no families are facing catastrophic costs or being impoverished by the management due to TB disease or leprosy or other lung conditions. So to focus on today's presentation, human rights are universal and are inherent in all individuals, regardless of race, gender, nationality, or other statuses. So human rights are universal. They apply to all human beings on earth. It doesn't matter where you come from. It doesn't matter your color. It doesn't matter which gender or race or sex you are. Gender and sex are different. Sex is the biological identity or biological makeup of a human being, while gender refers to the roles, behaviors, and attributes society considers appropriate for men, women, and non-binary individuals. It is important to understand gender because some roles and behaviors and attributes of gender affect how people access healthcare and affect also how much they are at risk of TB and how they continue to receive, how they interact with the healthcare system to be able to access care and treatment. So just to bring you on board about human rights grow out of basic equality and human dignity, so they are shared by all human beings. They are based on international human rights, the International Human Rights Treaty, which recognizes humans as an international community, and also individual citizens are required to respect their rights and also the rights of others or other people, other citizens, and other people of the world. So your rights do not only exclusively cater for you, your rights also protect, or you are expected to protect the rights of other people while you enjoy your own rights. In our Kenyan constitution, as you're aware, all international treaties must be domesticated in Kenya, and our law, our constitution accepts all ratified international treaties as part of Kenyan laws. And therefore, in our constitution, the International Human Rights Treaty has been incorporated in our constitution, and it states that all persons, in particular to health, have the right to full enjoyment of essential rights and of fundamental freedoms, including the right to health. That is in Article 43(1)(a), and you can check it out, and it outlines the highest, it's the highest attainable standard of health, which includes the right to care and care for TB and other health needs. So there are several principles that guide human rights implementation, and one is equality and non-discrimination. It applies to all, and everybody has equal access to the care for TB, regardless of their gender, race, or status. And also another principle is on universality. It applies to all human beings, and who are as long as you're a human being, you're entitled to human rights. Human rights are interdependent. It means that you cannot enjoy one right when another is infringed upon. For example, to fulfill the right for your right to health, there is also a right to information that needs to be fulfilled, and clean environment, clean water, etc. So you need to enjoy all the rights for you to be fully, to be said to be fully enjoying your human rights. And it calls for participation of individuals and communities. That means that individuals and communities are required to be involved in decision making that involves their life and their health. This brings us narrow down to TB, relationship between TB and human rights. Some people are vulnerable and are not able to access their right holders, but they are not able to access their rights. For example, because they are more vulnerable because they are not able to realize their civil, political, and economic, and also social and cultural rights for some reason. Or people, there's discrimination and stigma. In particular, people living with TB are often, their rights are often violated because they are presumed to have TB, or sorry, HIV, even when they don't have, and they are stigmatized, hence obstructing their access to treatment, and may affect their employment, schooling, and housing and other rights. Also, infringement of human rights impedes effective response, and especially when they are not respected. For example, when there is stigmatization, because including for people who use injection drug users, and this drives them, when we discriminate against them, or when they are not able to access their rights, and then they go underground or they go into hiding, therefore inhibiting the ability to reach this population, and the TB services do not reach them. So some of the key issues and barriers, human rights barriers to TB services, includes poor knowledge among patients and the population, so they are not able to perceive the risk of TB, and also they do not understand the effects of TB disease, and also the stigma that is related to it, and therefore it leads to late diagnosis because of the poor knowledge of diagnostic steps and expectations from the public, and also poor health service provider knowledge and capacity, and also lack of communication services, and also lack of equipment and resources to provide required diagnostic services. We also have challenges in treatment when patients have poor knowledge on the treatment that is required for TB, including being informed on the length of treatment, and also stigma associated to treatment with TB. Excuse me, do you want me to leave? Because just a moment, please allow me to, could you mute me for a moment? Because
Okay, so yes, so as we wait for Dorcas to sort out some of the issues towards her end, kindly ensure you indicate where you're coming from, the name, where you're coming from, the name of the organization, the county that you're representing. So please, I don't know whether now Dorcas is
Okay,
able
I'm
to.
back. I need to hurry because they need to use the room. Unfortunately, I had requested to sit here. So there's also, when we do direct observed treatment, there's misconception of the cost and preference for non-healthcare worker to provide this care, this kind of thing. And also people have stigmatized because of observed treatment, and therefore they may not be able to cooperate or to access care as required. And also during follow-up, sometimes people don't have enough knowledge that they need to be followed up after treatment, or they fear being stigmatized, and it affects their participation in healthcare. So the infringement of human rights is both at individual or community, and also the health system can lead to poor service delivery to the TB patients. So it's the obligation of government to ensure that the TB services are available, they are accessible and acceptable to the community and people, including minorities, and must be sensitive to gender and life cycle requirements for different cohorts, including unborn babies, infants, children, school-going children, young people and adolescents, young adults, and even the elderly, so that it's responsive to their needs. Also, it's the responsibility of the government to ensure that there's quality of service and ensure that the goods and services that are provided are of scientifically sound and medically appropriate for consumption by humans. So the government of Kenya, through the universal health coverage, has made efforts to ensure that all Kenyans access healthcare services, and it has done this through the provision of the Social Health Authority, and it has allocated primary care fund, social health insurance fund, and emergency and chronic and critical illness fund to ensure that all health services of the Kenyan people are provided and are accessed by Kenyans. And it takes into consideration for people who are not able to afford, and therefore provide patient support to ensure that they all access this. Besides ensuring that the poor people or those marginalized access care, there are also other non-medical interventions for patient support. And these are interventions that extend beyond medical care, including adherence to treatment, to support patients to ensure adherence to treatment, to reduce the risk of drug resistance in TB, and to enhance the overall well-being and reduce transmission of TB. So at the community level, we look at the household level, the workplace, the school, or where people play or are entertained, including public places, public social places. So the kind of support we look at is health education and advocacy to empower patients, medical support to ensure timely diagnosis, access to treatment, regular follow-ups and monitoring of side effects of treatment, psychosocial support to improve patient counseling, providing counseling and mental health to enable the patients to cope with the disease burden and stigma and to address stigma, nutritional support, socioeconomic support where the government provides for example, transport allowance and also for daily living cost for patients with drug-resistant TB. And this is provided through the care system. And as you can see, we provide baseline and follow-up investigations that are waived. We have the social health insurance fund subscription for DRTB patients, and the cash transfer for DRTB patients, and nutritional support, either for therapeutic purposes or for supplementary support. So the health workers have the role to ensure that the patient is informed, and also infection prevention measures are implemented at the point of care, and also education of the community to ensure that there's prevention of spread of disease. It is the responsibility of both the health worker and the patient also to ensure infection prevention measures, because the patient is a patient with TB, active TB is a primary source of infection. So they need to take responsibility. They also need to take responsibility to ensure that the people who have had contact with them are identified and are investigated and put on preventative TB treatment or TB treatment if found to have TB. Also, it's the responsibility of the patient and patient caregiver to support and educate, to be educated throughout the treatment and follow up by the health workers. And the health worker also encourages and links patients to join existing support groups if they are willing, and then they can be linked to the TB champions to support them through the treatment and care. It is also the responsibility of the health worker, to follow up the patient in subsequent visits and to ensure that all issues and challenges faced by patients are addressed, and they always continue. The health workers are responsible for continuous public awareness creation and building their own skills so that they are able to provide up-to-date and scientifically sound interventions for patients. So the community is responsible to educate for education and the importance of their contacts to be listed and screened and investigated for TB, and the care necessary is provided. At community level, to link each other with peer-led support groups to help with treatment and adherence to treatment, identification of TB champions and paralegal to be trained to provide TB paralegal services, peer support, and to also continue supporting sensitization of communities on TB, and also encouraging support groups and wellness groups in the workplace and also in the communities, and also where children are or where young people are going for education or entertainment, also to provide information and support for them and to reduce stigma and discrimination. It is also the responsibility of the community to sensitize and identify and report and monitor any human rights violation or concerns, including gender-based violence, to the community-led monitoring tools, and also to the healthcare system and the administrative system. So we have some key populations that the program targets, because they are not able to claim, they are rights holders, but as duty bearers, we try to ensure that we have enabled these vulnerable groups and populations to access their rights, and also to facilitate them to access TB care and treatment, because they are disadvantaged in the community. And this includes people in prisons or in detainment, people who use drugs, and healthcare providers also are a high risk, and they are stigmatized or fear to seek services because they are also reluctant, they self-treat, and sometimes they're afraid of their colleagues because there's a lot of stigma also within the healthcare settings. We also ensure that people living with HIV are examined and tested for TB, because they are a high-risk population to get TB, including key populations within TB, within HIV space, including LGBT persons, sex workers, and people who use drugs. We also have a population that we call mobile population, and these are migrants that should be protected, who have no status in some countries, facing discrimination because of the lack of legal documentation, and therefore have barriers to health services. So it's our responsibility to ensure that if we have such people in our community and system, that we support them to enjoy their right to health. Also, we have people living in poverty, including in urban and rural settings, and these people have inadequate housing and inadequate ventilation and sanitation, hence are very prone to TB. So we seek out in the program to ensure that we identify them and provide them with care. So in general, the optimum conditions for TB care includes a setting where there's no discrimination, there's no exposure to other risks, there's confidentiality, there's access to information, and as noted in the Constitution, we are required to ensure that everybody has the right to a minimum standard of health, and access to care should receive the highest priority to ensure that it is curative, if possible, preventative, of prevention of disease spread, and prevention, in this case of TB, of development of resistant TB. It is for this reason that the Ministry of Health, through the TB program, has developed a patient charter, which you can see. We have it in Kiswahili. You will forgive me, I have a lot of problems reading Kiswahili, but I will try my best. So the patient charter allows us to ensure that the patient's rights are followed and are accessed, and as patients are facilitated to access the highest standard of care through that. And in the charter, we have 8 sections. One is care, the right to free and equitable access to TB care from diagnosis to completion of treatment, irrespective of a person's race, gender, language, legal status, religious beliefs, sexual orientation, culture, or health status. The right to receive medical advice and treatment and fully meet new international TB care standards, and the right to benefit from proactive healthcare, community outreach, education, prevention campaign, and healthcare programs. Number 2 is taking care of the dignity of the patients to ensure that they are treated with respect and dignity, and have the right to the highest dignified environment to provide healthcare services with moral support from family, friends, and the entire community. Additionally, I think we mentioned that the rights are interdependent, and in our constitution, we have a right to information, and therefore in TB care, patients have the right to be informed of the services that are available, the TB condition, the treatments, and the direct and indirect costs involved in the care for treatment for TB. It's also, they have a right to access timely and concise information, including the description of the disease they suffer from, the diagnosis, the prognosis, or the outcome of the disease, the treatment that is being proposed, and the information about the common risks associated with the disease, and also some of the outcomes of the disease. And the right to know the names and dosages of the treatment they are on and the side effects of this treatment. And should they have any questions, that they are welcome to actually query or ask or seek guidance to be able to be informed further, or their issues to be addressed. And also, the patients have voluntary counseling at any time of diagnosis to at the end of treatment, and any other time they choose to seek that services. 4th is that they have a choice to the right medication and medical opinion, and some patients have a right to seek a second opinion. However, it's our responsibility as healthcare workers to explain to patients what is wrong with them, why they need it. So by the time somebody is leaving the room, they should be able to understand what they need. And if they feel that they don't have an adequate care, then they have the right and freedom to ask to seek second opinion. They also have a right to refuse any surgical or treatment, but based on informed consent, and also based on informed consequences if should they not accept to take treatment, and they are well informed about it in the healthcare settings. They also have a right to choose whether or not to take part in research programs, compromising their care. Confidentiality, I think somebody talked about it, is very important to ensure that the personal privacy, dignity, religious beliefs, and cultures are kept confidential. The treatment of the patient, the diagnosis, and every other information about the patient, and rights to allow them to choose when to release to the authority or to other people that they are sick. But we encourage them, because TB is an infectious disease and needs that we address other issues and other people that are predisposed based on the primary person who has TB. Also, the right to justice through the channels to complain or to appeal to a higher authority should they feel that they need. The patients have right to organization, to establish peer groups or support groups, or even clubs or community associations through care providers and support. And it is our responsibility as healthcare workers to provide the patients and the public with support and information and material to be able to organize themselves and to meet and to support each other at all levels, community levels, national level, even internationally, and the international health authorities recognize that as well. Lastly, is that there's the security. We try our best in the patient charter to ensure that we create awareness among employers and and also people who provide work or income generating in opportunities to people who suffer from TB, to ensure that they don't lose their job or their treatment, or if they need support at workplace, to be able to ensure that they have the care that they need to complete treatment, and to be able to visit the hospital, that they are able to do that. So patients have responsibilities, including sharing information about their own health to the health worker, and also history of contact with the other people, so that they are able to be contacted, like enlisted, contacted, and be screened for TB. They have the responsibility to follow the treatment as prescribed, to follow the regime, to follow the instructions, including follow-up, including adherence to treatment, and also cooperating to ensure that they complete treatment and they are cured of TB. And they have the responsibility to contribute to the community by encouraging others to seek medical care, especially those who are exhibiting TB symptoms, and also patients who have been in contact with them. And also, lastly, solidarity, where we join efforts together to ensure that we have a community-free TB, so that we work together to be champions, and also to support other people, and to ensure that there's TB prevention in the community. So in the spirit of World TB Day theme for this year, it's TB led by government, driven by communities. I think this presentation or this webinar was very crucial to ensure that we all participate and share the responsibility in solidarity. Thank you very much.
Thank you very much, Mrs. Dorcas, for that very informative presentation, and for helping us clearly understand the TB Patients Charter and the human rights of TB patients within our societies, or even within the working environment that we stay in. Your presentation has really helped me and maybe some of the participants appreciate the importance of ensuring that each and every TB patient receives care with dignity, receives respect, and even they should be protected about their rights. So just maybe we might have lost you for a moment, but I think we will be able to link up during the Q&A sessions that is supposed to happen after our next presenter has just spoken. So as we all know, policy and guidance are very important. It is also valuable to hear community experience and perspectives from those working closely with the affected communities within our societies. So it is therefore my pleasure to invite our next speaker, Mr. Samson Ochieng. So Samson Ochieng is a 27-year-old TB survivor, emerging medical technician, that is EMT. He is a music artist and dedicated TB champion who is based in Siaya County, Kenya. So Samson serves at Siaya County Referral Hospital, where he actively promotes tuberculosis awareness, prevention, early diagnosis, and treatment support within the community. So drawing from his lived experience as a TB survivor, Samson combines his healthcare expertise and through musical talent to educate and inspire community members through advocacy and even educational songs within that specific community, and even go beyond. So encouraging early health-seeking behaviors, that is also part of his work, and he also empowers people affected with TB. And his mission is to contribute much more to building a TB-free community and advancing efforts to end TB in Kenya. So Samson will also help us understand how better communities can promote awareness of the TB Patients Charter and support TB patients through their treatment journey. So Samson, you may kindly take the floor.
Okay, thank you so much for this opportunity. As you've heard, my name is Samson Ochieng. I am a TB champion based in Siaya County. And aside from that, I'm also an EMT, but I've been practicing as a TB champion, and since the time I got TB, and now I'm using the information to help us to eradicate TB and end TB. So I'm glad to be here. So as I'll address the issue that is on the floor, that is how does community support the Charter towards human rights. So number one, I'll say that before every other thing, the community has to understand what the TB patient charter is. That is the number one thing. I normally say that just the same way in our country we have the constitution, the same way as TB champions and as TB patients, we also have our own constitution, and that is the TB patients charter. So it is recommendable that we understand as a community the content of the patient's charter, what it outlines. Number two, community support toward the charter. Number two is awareness creation across the community. The community has been able to come up with several interventions such as school health talks, using posters, using local radio programs to talk about TB. We can encourage the use of such programs, the use of such to ensure that we are creating more awareness to the community. Creating a supportive environment for TB patients. There is this approach that we have been using as TB champions. We have been going to visit those who are affected of TB, so that we are giving them the whole package of what TB is, the understanding of TB. So when we all involve all of them in this, it will give us the whole approach, so that the whole family is able to support these patients in his treatment journey. So the fourth way that the communities support the charter is fighting stigma and discrimination. If one is diagnosed, we encourage chiefs to talk about it, and even at their workplaces. So through doing this, we can fight stigma and discrimination. We had recently we had a patient whom was not really doing well on his adherence, and we realized that the challenge was at the workplace, and so we went there and we went there, we did an health talk, and at the end of the day, we found that we addressed the challenge which was there. The challenge which was there was lack of information by the colleagues. And so after getting an understanding of what TB is and understanding that they can prevent themselves, they gave it a shot, came for TPT, and now the adherence is good. The patient did his month 2 follow-up, and the result was negative. So I think when we do that, we are fighting stigma and discrimination even at workplace. My last point is on empowering TB patients. When we empower our TB patients with information, they get to be our ambassadors outside there. And you will find that they will use this information to create even more awareness. Like currently, we normally have, in our clinic, we normally have this support group that is supported by AMREF. So currently, our TB patients, those who are on continuation phase, about to end their treatment, they are the ones who are now running the support group, so that they have a lot of information that they are using to empower others who are still coming up who are still on treatment, who are still down, so that they can also go through the treatment process and end well. I think I'll stop it at that, Vivian.
Vivian, you're on mute. Sorry.
Sorry about that. Thank you very much, Samson, for sharing your experience and for highlighting the important role that the community people play in supporting people who are affected by TB within our communities. So we will now move into our interactive session where we'll be able to engage both the speakers and the participants. And before that, I will begin with a few guiding questions and then invite participants to also share their reflections or even questions on the chat box. And if at all you're a participant and you feel like you have a question, you can as well just raise your hands. Once we are done, we will be able to unmute you and you will be able to ask the questions. As well, for the questions that are on the chat box, we will be able to go through them. So since now just Samson I've just completed, maybe I could just ask you a few questions. From your own experience as a TB survivor and now you are a TB champion, could you just share how stigma affects TB patients and the treatment, maybe the treatment journey, how it looks like as per the community that you're serving currently? Samson?
Okay, thank you so much. As I tackle that question, how stigma affects. So number one, there is a delayed diagnosis. Sometimes most of our patients, they fear being rejected. They fear being rejected or being judged. A good example, in our hospital, that is Sierra County Referral Hospital, some medics, I normally see them when they get an household, they bring them for screening, they bring them for testing. And in one instance, when one of the household was diagnosed with TB, when one of the house help was diagnosed with TB, I was surprised that the medic had to drop this house help to look for another house help. And that meant information gap, you see. And you see, if somebody gets such an information that somebody was fired, somebody refused to take an house help just because they were suffering TB, the other house help who is looking for a job will not come in, will not present herself or himself to be screened, even if they have the symptoms. So that will bring delayed diagnosis, and that in turn says more transmission in the community, because these house help will be like, I don't want to come out because my job is at risk or I'll not get a job. So the second thing is social isolation. Social isolation. Not sharing things like utensils, rooms, and the friends not visiting because you have TB. Generally, this affects men. Men tend to isolate themselves when they have TB. And sometimes you find that some of these men, they are single, or maybe the person they were staying with, who was there as a wife, has gone away because of their suffering. We end up losing most of these men, which is something that is really bad because of depression and loneliness and all that. And at the end of the day, it is all stigma. The number three is treatment interruption. Once a while, we had a patient suffering both on ART, suffering both on HIV and also having TB. This patient had poor adherence. Why? Because this patient was having hospital regular visits. And so instead of addressing the issue, the patient or the client decided to be allowed to not adhere to drugs and not adhere to the visits. So these are the causes of the stigma. We had to follow up the patient and bring her to understanding that, you know what, treatment is the only way and there is hope in the future. So those are some of the ways that stigma can affect our clients so that there is no treatment, there is treatment interruption. Thank you, Vivian.
Let me just confirm unless I'm muted. So thank you so much, Samson. And just to build onto that, I have another questions for you. Like, how is it important for communities to get to understand the TB Patients Charter, and how can this knowledge be very helpful to in terms of reducing the stigma and discrimination within our societies? Over to you, Samson.
Okay, thank you so much once again. The importance of for communities to understand the charter. Just as the statement that I began with, the same way our nation has a constitution. And so our constitution is the patient. So when there is, oh, sorry, am I back?
Yes, you're back, please. Go ahead.
Okay, thank you. There was just a small problem. So when we are understanding of this charter, it promotes respect and dignity with our TB patients. Remember, in the charter, one of the things that are outlined there is the right to dignity. Our patients need to live with dignity. If the community knows the content of the charter, even the level of gossip goes down in the community because this community is empowered with information. The second thing is information accuracy. When there is information accuracy, we have empowered these communities with information. We shall have done away with the myths in the community. There are a lot of myths surrounding TB in the community. And so when there is information accuracy, we shall have done away with the myths. There is a time we had a chief baraza, and we went and we shared information about TB, and we told them that if they come to the facility, they'll be seen even without any charge. And there was this mama in the community who thought that there were charges for screening TB. And luckily enough, or surprisingly, this mama who had been coughing for the last 3 months was diagnosed of TB. And so you see, because of lack of information or there was no information accuracy. So this patient was actively transmitting TB outside there because he thought maybe I'll be asked something at the facility. This charter also helps us that there is patient empowerment, and the patients can speak up for themselves. This morning I was fast tracking a patient, and noise was made at me that you know what, we came fast and all that. And so, I had to explain myself that, you know what, this is somebody we are suspecting of TB, and so please just. Sorry, you lost me again.
Now you're back. You're back now. Please go ahead.
Yeah, so after that occurrence, I realized that our patients are more informed. And this is just because of whatever we've been doing at the clinic. So this shows the importance for communities to understand the charter. When they understand the charter, they make work become the works really becomes easy. I think I'll stop it at that.
Yes, thank you so much, Samson. And from your experience, I believe there's a big gap when it comes to information. There's lack of information within our communities, either from the community angle or either from the healthcare workers, because it really feels so bad when you tell me like this healthcare worker is trying to stigmatize the other person because they feel like maybe probability are they might infect this person within the same society or maybe the household they are staying in. So it's so bad because I've had the same scenario apparently, whereby now I'm a healthcare worker whom we basically work with had the same situation. The house help turned out to be having TB. The patient was started on treatment, and later on, when now this employee who is now the healthcare worker noticed that the person was coming here for treatment, they really felt like that was really bad, and she went back home. And the next day, she told me she had to dismiss off the house help. Of which for me, I had to do counseling, of which is not a good thing for me. I don't feel like it's a good thing. So that's why we are talking about having information in our institutions, having institutions that includes the schools, either primary, high school, or even in higher learning institution. Knowledge and information is very key within our society. So I think that is another gap that we really need to work on as the state and the non-state part. It doesn't define either we are the state, either we are the non-state. All of us are one, and we are one society, and we are working for the better of our communities. So on to my question, maybe for Dorcas. I don't know whether Dorcas is still online so that I can be able to ask my question. I just wanted to know from a policy and a program perspective, how can a healthcare system and community leaders work together just to ensure that the TB patients charter is respected and it's also implemented in practice? On to you, Dorcas.
Thank you very much. I think my colleague has really tried to highlight the purpose of a patient charter. I think the main purpose of a patient charter is to make clear the expectations. What is expected of the health system, what is expected of the healthcare worker, and what is expected of the patient. And when there's clarity of responsibility and the roles of each of the people trying to provide care and those who are receiving care or demanding care, then it is easier to provide efficient and effective health services and also to hold each accountable, including the patient, because in TB care, the patient is also has responsibilities to disclose, for example, his symptoms, to disclose those people who he has been in contact with, and to disclose if he has ever had other conditions that could risk increase the vulnerability, and also to ensure that they are followed up and to just speak the truth. Additionally, it also clarifies and provides information so that everybody is aware, standardized information, everybody is aware what we are all supposed to do at whatever level of care that we do. So it is important that the national government has the responsibility to develop guidelines and policies and put in place mechanisms to deliver healthcare services throughout the country and ensure that all counties are able to function and to provide care based on standardized care, based on policies, standardized policies, legislation, and standard operating procedures. So a standard TB patient charter is a standardized, national standardized charter for all patients. So the counties and the community structures are supposed to draw from that standardized charter so that a patient in Makueni, a patient in Turkana, and a patient in Malindi or Kakamega is able to access the service, standardized service of care based on the patient charter. The information is given is standardized, the treatment given is standardized, and the follow-up and care and all the other services are standardized. And it is also for accountability, because sometimes patients are not able to adhere to treatment and maybe they get DRTB. So they should be held accountable as much as if the government or the healthcare worker failed, they should be held accountable for the failure on their part. Should they have failed to inform the patient any information that empowers them to take responsibility for their own health. So the government can only work through the national government by developing standards and guidelines and legislations and ensure that there is availability of resources for healthcare. But it is also the role of the county to ensure that it is implementing those policies and legislation and standards that have been developed, including the patient charter. And down through the different levels of care up to the community level, where we have CHPs who are able to also disseminate the same information, and they work with other the TB champions and the religious organization, all to be able to implement, to understand the patient charter and therefore take responsibility and accountability for their own health. Additionally, we have translated the patient charter to Swahili to make it easy for the people to understand, even those who are not able to speak English. And I think within the communities that we can work together to translate to the local dialect, for example, or even just work together to develop some key messages from the patient charter, so that if you go to a community setting that you need to speak the local dialect, then you're able to highlight some of the key messages from the charter. And I think that would really be helpful to the patients and to up to the community level. And we can work together with the administration departments so that we are able to do that. We can work together with schools and even Parents' Day and even workplaces around us, because workplace is not just an office that we imagine it is people going to an office. That office is within a community. So even if you work in Nairobi in a high-rise building, it is in a community and somebody is responsible for that environment. And therefore, we are able to also communicate with people in settings of work, settings of education or institutional settings, and also entertainment, where we say you work, you play, you sleep. So play can be in the field, it can also be entertainment areas, socialization areas. Young people, TikTok is a social place where people nowadays are going to enjoy themselves, so we can access there and circulate or create an environment that young people are actually able to access this information effectively. I hope I have answered your question, Vivian.
Yes, you have, Dorcas, and thank you so much for that. And I liked the aspect that you brought on board about the issue of accountability. It really means a lot. Just a minute. Mngojee tu kidogo nakuja. Okay, sorry about that. So I liked the part that you talked about accountability, because I feel like there's a lot of gap when it comes to information. And whenever a patient gets to work within the facility, you do not just dispense off like the medication without telling them this is what is happening, this is how you're supposed to be taking your drugs, you're going to consume it for this period, and you're going to do follow-up just to check up on how you're doing each and every time. We're even going to do dots if needed be, so that this person can be at par, so that they are able to complete their journey and even be able to be champions like us, to be able to advocate for other people. And the fact you talked about, you're planning about translating the TB patients charter to different dialects, it makes me proud, because I'm like, yo, when I'm in Turkana, this person is not able to read in English or even Swahili. They're able to like be translated
Vivian,
for
point
really
of
easy
correction.
without any.
Point
Yes.
of correction. We have it in Swahili.
Yes.
So you asked me how
Yes,
we
I said
can work with the community. So at county level and at community level, I think we should all work together to ensure that it is also further cascaded in translation. But I don't think that we can commit at this point to say we will translate to all the dialects. But we can work together to ensure that the message that the people at the community level, you can work with your county TB coordinators and the health promotion people there, and they can work with experts who speak Swahili and the local media. In Kenya, every county has some local media. So we can work together sometimes as partnership or even corporate social responsibility to help us translate, so that if you go to radio station in Migori, you can speak in Kuria, I think. You can speak in Kuria and still speak the same to what is in the patient charter. But it should be the standardized, the correct translation, so that it is not misleading. And I think really the patient charter is supposed to empower patients to be self-agents, because sometimes people fear the health system. When you find a health worker, you're afraid to ask a question or you're afraid to demand some service. But the patient charter is informing the patients and the public that they have a right to health, they have a right to access the quality health services, and they have a right to demand the service. And they can question, they can query, they can ask questions, they can seek clarification confidently without needing to feel self-stigmatized or needing to fear or to, it is their right. We encourage dialogue and we encourage patients. And health workers, I believe health workers are not bad people. They are humans too, and they are trained to serve patients in the best capacity that they can. They are compassionate, and I believe that they are able to interact with patients enough to, it is for mutual benefit that patients and health workers comply with the professional care, and also the patient to support the healthcare worker to be able to give them the best service that they can, and to cooperate with the instructions that are being given, and to share how they feel, how they are going on treatment, and any seek clarification. I think it is the purpose for the patient charter to provide the opportunity for interaction and mutual benefit for the patient and the healthcare provider.
Okay, thank you so much, Dorcas, for that. And I'm glad the fact that we have the TB patient charter in Swahili and in English. But I know there might be the aspect of financial issues, but in future, we are praying that now it goes to other languages within specific regions that we are in Kenya.
Yeah.
So thank you so much, Dorcas, for that. Maybe just to, we would like now to take questions from the participants, just to go through them so that we are able to answer each and everyone. I'll take one from Stephen Angova Shukole, and he is saying that a question to Sam, a quick one. How did you overcome stigma, and how is the county supporting your efforts as a TB champion? Over to you, Samson. Samson, if you're there, that's your question.
Oh, thank you so much. Thank you so much, Steve, for that question. I think I've faced stigma in several occurrences and several instances. And it was not easy overcoming stigma, because there was a lot of things that came with it. I could ask myself, why just me and all that. And I realized that it was just because of lack of information that I was facing stigma. Well, my healthcare worker was seeing me at that moment. Okay, I'm this person who is always free. I will always ask and all that. So I poured out my heart to him, and he told me, because during that time, what happened? There were a lot of myths surrounding that, and I even thought that maybe I could be having HIV and all that. But my healthcare worker supported me. I was taken for an HIV test, and after that, okay, it turned out negative. Okay. And at least I was like, okay, so I'm not HIV positive. And so that eradicated the myth that if you're having TB, you are having HIV. The healthcare worker supported me, being that I became free with him. And through that support, with providing me information, I got encouraged. Like these 6 months, I know I'm going to clear it soon. These 6 months is not something much, you see. And I honored my clinics. Several instances while working closely with the chest clinic, I've also experience stigma that has been directed to other patients, whereby they have been stigmatized. You see, there's this common phrase that is given unto them, watu wa TB in Kiswahili, in quotes, watu wa TB, you see. And so you see, sometimes when they are called such, they feel like they don't really feel comfortable. And so you realize that they have stigma. So I give information to them. I also give information to them, making reference that, you know what, I also suffered this, and I understand what you're going through, but now this is the truth and all that. Yes, you have this disease, but you can overcome it only by taking your treatment. And then I've also done my part by also empowering other healthcare workers so that they address these patients normally, like other patients, not giving them names in quotes, and not uh, uh, putting it like whatever they are suffering is something so serious. As much as, yes, maybe it is so serious, but it's not that serious anyway. So that is how I've been able to overcome stigma, though there is still much work to be done, especially in the healthcare workers side. You see, sometimes maybe a patient presents himself at the reception, because I normally sit at the triage area. And you see, when they just say that, you know what, I just came for TB drugs and all that, you will see that stigma. The healthcare workers, they will run to take the mask, and and all that, with all that empowerment that they've received. And you see, that comes about because some of them have not taken TPT. And so you see, for me, I'm not like when I get a TB patient, I'm not that scared as compared to them. And sometimes they ask me, why are you not wearing mask? Don't you think you will get TB and all that? And let me tell you, all these years that I've worked closely with the chest clinic, uh, 7 years down the line, when I cleared my KCSE, 7 years down the line, I've not been infected again with TB. So the county has also supported in several ways. The county has brought out, come up with flyers to give information about TB. The county has organized several health talk sessions for us, so that we take charge to advocate about TB, so that we can reduce the stigma that is in the community. So I can say the county has really given us that mandate, and has really been working with us closely as TB champions, so that most of the things related to stigma, we are the one curbing them. And also in liaison with our clinician in charge. Mostly, there are some patients that come with stigma related issues. You will you will see him call always another TB champion to come and help in addressing the stigma issues. So I really appreciate. And one thing, I heard that the charter has not been translated into other languages. I think that is one thing that I have to appreciate our county, that with us, we have our charter that is translated in Luo language. So I think we went ahead of time as a county. Thank you.
Oh, that is so nice. It's good to know that your patients in Siaya County are able now to go through the patient's charter in their Luo language. Like, I can imagine the thrill in it, like just reading these things in my language now. It's very direct and it's very easy to understand compared to maybe reading English that is so a little bit complex for somebody who is not well versatile with English. So another question now, this one I think it's from Madam Dorcas. She's called Agnes Okose. She's asking, her area of concern about human rights is the vulnerable population who are high affected by TB. due to their financial situation, how will they get access to health services like earlier TB diagnosis, TB x-rays, which are required to pay in many facilities. Otherwise, they have to wait for a free community outreach just to get the free services, hence causing delayed diagnosis to the patients within Busia County, if I believe, Agnes are coming from Busia. On to you, Dorcas.
Thank you very much. As I presented in the presentation, TB services are provided free to the public. It doesn't mean it's free. The government caters for the finance. But once somebody is screened and is found to have any symptom of TB, they are actually taken up by CHP at the hospital, and they are fast-tracked to access care. So they go for a TB, for a chest X-ray and the laboratory investigations, and it's also waived for investigations of TB. And if they are found to have TB, then the treatment for TB is given free of charge to the patient. So they don't have to wait for examination, for an outreach. They can go to the hospital. Furthermore, even in the social health insurance provided by the government, it caters for people who are not able to afford. If they have registered and for sure they are not able to afford, the government has a percentage that has catered for the indigencies, people who are very poor in our community or very low, they are not able to afford care. So I don't think that, I think from the patient charter, you can see that we provided care. We presented that the TB services are free. And number two, that if you have a symptom, then it's also your responsibility to go to the hospital for screening, and it is waived. You will not pay anything. And if you found to have TB, you'll get treatment. Also, if you have ever been in contact with somebody with TB, then it was the responsibility of the patient who had TB to disclose that you are one of the contacts, and you would have benefited from being invited for screening. And if you had TB, you would have been put on treatment. And if you did not have TB and you are eligible, you would have been put on treatment to prevent TB occurring in you if you had ever had contact with a patient with TB.
Thank you so much.
I hope I have answered the question.
Yes, you have. Thank you so much for that. And I hope Agnes is able to listen to that and you will act appropriately. On to Joshua. Joshua, you're asking you would like to join TB Champions Team Network. It's okay, you can join the network of TB Champions Kenya. I can link, I've taken your number, so maybe we will link up later on and we will be able to talk about that. And you have a concern that there's a priest, a pastor who prayed to a client and they said she'll get healed. Okay, praying is not, let me just try and answer that. Praying is not bad, but that does not entail us or that patient stopping their medication. The pastor can keep on praying, yes, but let us keep on taking and adhering to the medication as prescribed by the healthcare worker. Do not stop your medication because the priest you believe in has healed you. Let us just, okay, they normally say that we can treat, but God heals, okay? So as long as you are there to those medication, you are able to be healed. And the pastor at least will feel that whatever the prayers he was praying for are fulfilled. And someone is saying that there's information accuracy is really a keep up. Is it possible to get slides for the soft copy? That goes to Dorcas. Kindly share the soft copies. Maybe they'll be able to go through the documents as well.
Yeah.
So Anastasia is asking, there is a very big gap in information accuracy. That's where we should really try and gap, because with proper information, there will be early diagnosis and smooth treatment process plus no stigma. I totally agree with you, Anastasia. There's a big gap when it comes to information, and that really needs to be worked on. And Joyce from Muranga is saying collaboration in mainstreaming information is key to cascade information. We have great resources, media, TB champions, local medias, healthcare providers, information, educational communication. Of course, collaboration is very key, Joyce. We really need to collaborate for us to be able to attain our goal of ending TB and having a free TB world. So I don't know whether there are questions I might have left. I don't know whether there are questions I might have left. That one I've answered.
I think just to add on to what you have said,
Yes.
remember that there are other patient needs. For example, there are medical needs and non-medical needs, and religious needs are also valid patient needs. But I think the patients need to be aware that their spiritual needs are very different from their medical needs, and they can be provided alongside each other as long as you stick to the treatment. You can be prayed for to boost your faith, to boost your well-being, mental well-being, spiritual well-being, emotional well-being. But remember that TB is caused by a microorganism, and that microorganism can only be treated with a medicine. So while you take your medicine, your pastor can pray for you. You can pray with them, but remember that you need to be on treatment. And you actually need to even empower that pastor so that you can be able to create awareness in the church where you go. Because a lot of people also gather in the church, and maybe that's an opportunity to educate others about TB. But we try our best as healthcare workers to provide information to patients. And the charter actually provides the role of the patient to seek clarity. And if it's not enough, if you think you want to go for an optional treatment, then discuss with your healthcare worker and address the issues why you think you will not continue with treatment. Because sometimes people feel better immediately they are begun on treatment and they think they are well. Otherwise, you put a chance for you to develop resistant TB that is resistant to care, and that is a very difficult disease as well. And also, you can have you'll be reinitiated on treatment, maybe stronger medication, and you might even have complications with your lungs and your other body systems. So it's crucial that we continue to create awareness. And as I earlier said, this is one of the series in the webinars. Others have happened before where we were educating the public about signs and symptoms, the risk factors, the transmission, and what they need to do to seek care and what care really entails. So this is just to remind us our responsibility as healthcare workers and also as patients in the management of TB. Thank you very much.
Thank you so much, Dorcas. I'm just going through. There's a chat that I don't know. I feel like I left out. Okay, so David Taro from Homa Bay is saying the most important thing to end stigma is to give information to the community members and also TB clients. That is very true. And who is this? Frederick. Frederick is saying, let all TB champions be active to their working area to create awareness and health talks. As we talk about TB champions, let us also not forget about the aspect of CHPs who are also working within our communities. So we should be working hand in hand with them so that we are able to find out the new TB cases that are there within our communities. So it's all about collaboration. It's about us working together as a team for us to be able to end TB. Let me just see if we have more questions. Okay, so someone is asking, at their facility, we have challenges on TB sample transportation. Kindly assist. This is Kajiado East Sub-County. How do you go about that, Madam Dorcas?
We think there are systems to address that within the TB program. Please get in touch with your county TB coordinator and also your sub-county TB coordinator. I think they will be able to address that. Yeah.
Okay, thank you so much. And we've been having issues when it comes to nutrition aspect. Now I'm seeing someone here asking on nutrition support, what's the plan for the national TB? Oh my God, it is gone. Okay, it is asking on nutritional support, what's the plan for national TB program, because there is stock out of nutritional supplements when it comes to different counties. And that one I can testify, actually, when it comes to nutritional supplements for TB patients, it's always a little bit hard for them to get the supplements. So how do you go about that, Madam Dorcas? Today, it looks like the questions are definitely going on your end.
Yeah, we all actually have a shortage in the country, and it is about the global supply. But in the meantime, we encourage patients to work with communities and community support to be able to provide them with food. For example, the best supplements are natural foods that we have in plenty in our country. just how to prepare it and make it different and palatable to encourage a patient to take it. But in the meantime, the government is still working to see if they can get the supplements in the system. But it's really a challenge to get it. And it's because of a global supply, short of supply, and the costs.
Okay. Thank you so much. Do you have any more questions? Somebody saying kudos to the team for a good session, a good
Thank you.
presentation, good moderation, very informative. Thank you so much for that feedback. We really appreciate those kind of feedbacks. Thank you so much. Being there are no more questions, let me check if we have any more in the Q&A. Yes, so Stephen Shukoli as well was asking, do you think we have enough tools to address stigma in the community? This one goes for both, for Dorcas and Samson. Maybe you could, maybe Samson could go first, then Dorcas. Thank you.
I think so far tools have been there, but not enough to combat stigma. Yes, posters and all that that gives information has been provided, but I think still more is needed because there are a lot of people that are still, we have still not reached out to them so that we can be able to say that we are done with the stigma. So I think we still need more tools. Yeah.
Thank you so much, Samson. On to you, Dorcas.
I do not know which tools we need. In my opinion, I think the tool we need is information and demystifying any myths. And I think participation of TB champions is very crucial, and also to disseminate the information material that we have, and young people and different cohorts of the population to engage their peers. I think that is really the biggest tool, is information, and making it, creating awareness and not isolating or stigmatizing people who have TB, embracing them and teaching them and empowering them that you will be well, it's curable, and that if you just adhere to treatment and prevention measures, then you are able to enjoy life and also protect others, and others will protect you and support you to complete your treatment. And if you're cured, then you're cured, and you only have to look out if you should have any complications. So if we demystify all this, I think we will go a long way in actually minimizing stigma in our communities. And talking about it in all settings, at every place, in every language. I think the tool that we need to look into is tools for people with other disabilities, for example, the hearing, the sight, vision, etc. I think that's where the challenge we have. And we should be able to ensure that they access information as much as everybody else.
Okay, thank you so much, Dorcas, for that. I hope you've been answered. The best tool is in having that information. That is our first tool that we need to have. And somebody here is saying at Kware Dispensary, we partner with local churches to offer some nutritional support for the most vulnerable when it comes to TB. I think that is very good at Kware Dispensary. Kudos to you, team. Keep up going with that. And as well, other facilities, I know you might be having issues when it comes to nutritional supplement to support our TB patients within specific communities. But now that we are having the donor funding issues, I think it's also a high time for us as Team Kenya to do the domestic resource mobilization from our end, just like at Kware are doing currently. And I think that can really benefit some of the people from the community who are TB patients. Thank you so much for that. I really love the aspect that you're engaging the community to help the vulnerable within the society. Thank you so much for that. And I think somebody is asking, what is the difference between latent TB infection and TB disease? Dorcas?
As I indicated in the beginning, latent TB is when somebody has inhaled, for example, the TB bacterium, and your body has contained it. So you have the bacteria in you, but your body immunity is strong enough to contain it. So it is not flaring up, it is not infecting you. But when the opportunity is ripe, then the infection comes out and affects your body so that you have signs and symptoms. That is TB infection.
Okay.
It's
Thank you
active
so much.
disease. Yeah.
Thank you so much for that. And I hope the person who asked that question is able to know the difference between latent TB and TB disease itself. So all in all, I would really love us to keep on going, engaging, interacting as more, because I see like there are a lot of people who really want to join different certain groups. There are those people who really want to learn more. There are those people who are just starting from the basics. But since we are limited to time, this is not the end. But I would really pray that I hope this March is not the end of us having webinars in regards to TB. We are going to continue having sessions, and we will be able to pass out information out there. And there's somebody who also asked about being paralegal. I don't know whether Christine is in the room. She can be able to answer that, how to join, how to be a TB paralegal, or even just a paralegal in general. I don't know whether Christine is in the house before I close. Christine? Okay. So I believe she's not there, but
I think, Vivian, we need to close because I'm going to close another
yes,
meeting shortly.
please,
They are
Dorcas.
waiting for me.
Okay, it's okay. Thank you so much, Dorcas, for being part of this webinar, and we really appreciate each and every time you spared and the information that you've given out there. We really appreciate, and thank you so much. Okay. So I believe Christine is not maybe within, or maybe she's unable to, she's having different challenges. So just to end on this, as we prepare to mark World TB Day that is scheduled to happen on 24th March 2026, let us all remember that ending TB requires collective responsibility. It is not about the government itself, it's not about the healthcare workers itself, it's not about the specific communities itself. It is about not even the individuals, it is about us coming together and working for the betterment of our communities that we serve. So together, through the awareness, the compassion, and the action that we get to impact in our daily lives, I know we will be able, as champions, as the government, as the healthcare workers, all those groups, to be able to end TB. So I would sincerely like to thank our speakers, that is Ms. Dorcas Akiptui and Mr. Samson Oching, for their valuable insights and contributions for today's discussions that we just had. And I also thank all our participants and partners. Let me not forget about partners, because I've been talking about the MOH, that is the government side. I also thank all the participants and the partners for taking time to join us today, and for your continued commitment to strengthening TB awareness and patients' rights in our communities. With that, we come to the end of today's webinar, and I have been your moderator for the session, Vivian Faith. Thank you all once again for joining us today, and I wish you a wonderful, wonderful evening. As you go back, please do not sit on the knowledge about TB. Go back and dispense the knowledge. When you sit with that knowledge, it is not very key or important for you, but it is important if you deliver it for the society. Thank you so much, and you all have a good evening. Bye.
Bye, and thank you for your time.